Well, the FDA has reversed its 2022 ban on Juul e-cigarettes, now allowing the sale of the original devices with tobacco and menthol flavored cartridges to adults. The decision is sparking debate about the efforts to reduce the youth vaping epidemic.
Yeah, Dr. Michael Ong is a professor of medicine and health policy management at UCLA. He's also the chair of the California Tobacco Education and Research Oversight Committee. So he's joining us this morning to talk about this reversal. Thanks for being with us this morning.
Thanks for having me.
Okay, so Juul is not FDA approved, but the agency says the benefits to adult smokers outweighed the risk to young people who don't smoke. So does research show that e-cigarettes help adults quit smoking?
So I think there are a couple of different points to, in terms of this new approval process that happened.
Okay.
So the approval process that the FDA just did is something called a pre-market tobacco product assessment. And that's not to say that these products are safe, but this is just to make sure that these products are not so unsafe that they should be taken off the market immediately.
Okay.
So I think that in terms of these products, they're allowed to be sold to adults over the age of 21, just like any other product that we would potentially monitor.
Go ahead.
With regards to helping adults potentially quit using traditional cigarettes, we know that traditional cigarettes are definitely the worst thing possible to potentially use.
Okay.
Now, when you use electronic cigarettes, while they don't have as many carcinogens and as many health harms as traditional cigarettes, they still have health harms.
Okay.
So nicotine is one of the most addicting substances that we know. We also know that there are cardiovascular effects from nicotine, and particularly for youth, there are brain effects that also happen, particularly developmentally, and they also affect memories. So it's not a benign product overall. It is true that if you are a person who uses traditional cigarettes, there are studies that have shown that using electronic cigarettes can reduce the overall use of traditional cigarettes. But we often see that those individuals who are using e-cigarettes to try to quit traditional cigarettes often continue to use e-cigarettes. And so there are other types of products that have been on the market for a long time, nicotine replacement therapy products, that actually completely reduce everybody's use of tobacco products. So it depends on what you're looking for.
Okay. Now, e-cigarettes are made for those over 21, but we know that young people are using them. Talk about the marketing of these products and why young people seem to be attracted to them.
So we know that youth really are engaged by adult-oriented marketing. Youth want to be adults. So we know that when products are marketed towards adults, youth are going to want to use them. And we know that when Juul first came onto the market in 2015, we saw this large rise in terms of e-cigarette use. Now, part of that is because of the marketing, part of it is also because of the flavors. And so Juul has voluntarily pulled off the flavors that they used to have, such as fruit and mango, that we knew that youth really wanted to use. And in California, it's no longer allowed to provide any flavored tobacco products, including menthol.
Right, to not attract to the younger users. Okay, you know, I think in 2025 to still be having a conversation that people use cigarettes with all of the known health benefits, but people really struggle with this. People who are addicted to cigarettes or now e-cigarettes. What are some of the effective methods you see for quitting smoking? If you aren't going to switch from regular cigarettes to e-cigarettes, you really say, I want to be done with this altogether.
So I think that the most important thing is actually working with healthcare providers, because there's a lot of medications that we can provide as well as counseling. The great thing is that in California, we do have free counseling available to everyone. That used to be called the California Smokers Helpline. It's now called Kick It California, but that's free help that anybody can access. And then on top of that, there are other medications that we know that can help people reduce their use of nicotine products, as well as other types of medications that we can prescribe to help people with these addictions.
And quickly, do you think we need to have any policies in place to really prevent these e-cigarettes getting into the hands of young people?
So I do think there are some policies that we could do better on. I think that number one, we know that if we have these products available to youth nearby where they are, so if we're selling these products near schools, I think everybody can agree we shouldn't do that. We know that youth are particularly price sensitive, so anything that increases the price of these products, such as increasing the tobacco tax or reducing the discounts that you can get in terms of these products, that will also protect youth. I think that the other thing is that we also know that in terms of the retail environment, we actually monitor through undercover sales or undercover monitoring of sales for these type of products, because that's federal law. We have to do that. And we know that in California, that's actually gone up. And so it does come down to the retailers needing to do a better job in terms of making sure they're not selling to youth. There are new laws that were passed in California. State Senator Rubio from West Covina was the person who led this last year, that are going to be implemented this year, that are going to increase the penalties for retailers that sell these products to youth.
All right, definitely something we'll keep an eye on. Dr. Ong, thank you so much for joining us for this conversation.
Thank you for having me.